It's roughly 40,000 years ago. You are not in a hospital. You are not in a waiting room. There is no receptionist asking for your date of birth, no doctor with a white coat, no pharmacy, no antibiotics, no painkillers, no little paper cup full of tablets, and absolutely no one saying, your appointment is running only 20 minutes late, which somehow means 2 hours. You are standing near the mouth of a cave. Your foot is cut, not a small cute cut. Not the kind where you put on a bandage and complain for moral support. This is a deep cut from sharp stone, or a bite, or a fall while chasing an animal that clearly did not respect your meal plan. The ground is cold. Smoke from the fire is burning your eyes. Somewhere nearby, someone is scraping animal hide. A child is crying. A wolf is watching from the dark like it has read the dinner menu and found your name. And now you have one very serious problem. If that wound gets dirty, you may die. If you cannot walk, you may not hunt. If you cannot hunt, your group may have to feed you. And if your group decides you are too much trouble, well, ancient customer service was not known for its refund policy. So what happens? Do you just lie there and hope your immune system has a motivational speech prepared? Do your friends rub mud on it and say, "This worked for my uncle"? Do you chew a leaf because someone's grandmother swore by it? Or did ancient humans know more about healing than we usually imagine? That is the strange question at the center of this story. How did ancient humans survive without doctors? And the deeper question is even better. Before hospitals, before medicine bottles, before x-rays, before surgery rooms, before anyone understood bacteria, before anyone knew that tiny invisible living things could crawl into a wound and ruin your week, how did human beings keep each other alive long enough for us to become us? This is not just the story of ancient medicine. It is not only about herbs, bones, or skulls with holes in them. Although yes, we are absolutely going to talk about skull holes, because ancient history has no chill. This is really the story of how humans learned to pay attention, to pain, to plants, to animals, to wounds, to fever, to childbirth, to broken bones, to patterns. Someone eats a certain leaf and feels better. Someone touches a burning stick to a wound and the bleeding slows. Someone washes a cut in running water and survives. Someone else does nothing and dies. And slowly, across thousands and thousands of years, humans begin collecting little pieces of practical knowledge. Not science in the modern sense, not medicine with textbooks and exams and someone crying over organic chemistry, but knowledge, messy knowledge, trial and error knowledge, grandmother knowledge, hunter knowledge. Do not eat that red berry unless you want to meet your ancestors today knowledge. So when we ask, how did ancient humans survive without doctors? We are not asking why nobody got sick. They did. They broke bones. They got infections. They had parasites. They suffered toothache so bad that modern humans would immediately search for an emergency dentist and then complain about the bill. They died young. Many children did not survive. Childbirth was dangerous. A simple wound could become deadly. But not everyone died. And that is where the story gets interesting. The short answer is, we do not know exactly. The long answer is much more interesting. The obvious explanation is that ancient humans were just tougher than us. You hear this idea all the time. People say, back then, humans were stronger. They lived outdoors. They ate natural food. They could handle pain. And sure, ancient humans were physically adapted to hard lives. They walked more. They climbed more. They carried things. They knew the land. They were not sitting in a chair for 8 hours and then wondering why their spine had filed a complaint. But they were tough is not enough. Toughness does not fix a broken thigh bone. Toughness does not remove an infected tooth. Toughness does not deliver a baby safely. Toughness does not stop bleeding forever. And toughness definitely does not explain the strange archaeological evidence we find again and again. Ancient people who survived serious injuries for years. That tiny detail changes the whole story. Because if someone survived a major injury in the ancient world, it usually means something else happened. Someone fed them. Someone protected them. Someone cleaned their wound. Someone helped them move. Someone cared enough to keep them alive. In other words, survival was not just about being strong. It was about being in a group. That sounds simple, but it is huge. Modern medicine often makes healing look individual. You get sick. You go to the doctor. You take medicine. You recover. But for most of human history, healing was social. Your body did part of the work. Nature did part of the work. Plants may have helped, fire helped, rest helped, but other humans mattered most. Ancient medicine began before medicine had a name. It began when one human looked at another human in pain and decided, we are not leaving you behind. Let's go back to the basic human problem. The human body is both amazing and ridiculous. It can heal a cut, repair bone, fight infection, grow new skin, and survive extreme hunger. But it can also be defeated by a tooth, a scratch, a spoiled meal, or one mosquito with a bad personality. Before modern medicine, the world was basically one large obstacle course designed by someone who did not care about safety regulations. There were sharp stones, thorn bushes, wild animals, snake bites, dirty water, rotten meat, parasites, smoke inhalation, cold nights, heat, hunger, childbirth, violence, falls, bad teeth. And remember, there were no shoes like ours, no clean bandages from a packet, no soap in the modern sense, no germ theory. Germ theory means the idea that many diseases are caused by tiny living things like bacteria and viruses. Ancient people did not know that. They could not look into a microscope and say, "Ah yes, that little monster is why my leg smells like regret." But not knowing germs existed does not mean they knew nothing. Humans are pattern machines. If water from one place makes people sick and water from another place does not, you remember that. If meat near the fire lasts longer, you remember that. If a bitter plant helps with stomach pain, you remember that. If someone's wound smells bad and then they die, you remember that too. Ancient people had no laboratory, but they had observation. And observation is powerful. They watched animals. Many animals seem to use plants or behaviors that help them deal with parasites, wounds, or illness. Humans may have noticed this. A chimp eats a rough leaf. A dog eats grass. Birds use certain plants in nests. An animal licks a wound. Ancient humans did not need a medical degree to think, "Interesting, that creature is not doing that because it enjoys bitter salad." They also watched each other. Pain teaches quickly. Fire burns. Cold numbs. Pressure slows bleeding. Rest helps a broken limb. Clean water feels better on a wound than dirty swamp water. Smoke keeps insects away. Heat makes food safer. This kind of knowledge builds slowly, over many generations. One person discovers something. Another person remembers it. A child watches. A story forms. Soon healing is not just a reaction. It becomes tradition. And tradition is basically ancient Google, except the search results are your grandmother, and she is much harder to argue with. Now here is where the evidence gets weird. Archaeologists cannot dig up an ancient human's medical advice. They cannot find a Stone Age note that says, "For headache, chew this bark twice daily and avoid arguing with your cousin." Most prehistoric people left no writing. Prehistoric simply means before written records. So if we want to know how they handled sickness, we have to look for clues. Bones are one of the biggest clues. Bones remember things. A broken bone can show whether it healed. A skull can show trauma. Teeth can show infection, diet, and even tiny traces of plants. Skeletons can reveal whether someone lived for years after an injury that should have made survival difficult. One of the most famous examples is Shanidar 1, a Neanderthal found in Shanidar Cave, in what is now Iraq. Neanderthals were close human relatives who lived in Europe and parts of Asia before disappearing around 40,000 years ago. They were not cartoon cavemen. They made tools. They used fire. They hunted large animals. They likely cared for each other. Shanidar 1 had a hard life. He had serious injuries. His arm was badly damaged. He had head trauma. He may have had poor vision in one eye. His foot showed signs of injury. And yet he lived for decades. For a Neanderthal, he reached an older age. Think about that for a second. This was not a person who could just casually run after deer, carry heavy loads, and fight off danger like nothing happened. If the interpretation is right, he survived because his group helped him. That matters because it suggests something very old and very human. Healthcare did not begin with pills. It began with care. Another strange clue comes from teeth. Teeth are disgusting little time capsules. Plaque can harden into dental calculus, which is basically ancient tartar. It sticks to teeth for thousands of years. Scientists can study it and find traces of food, smoke, plants, and microbes. In Neanderthal teeth from El Sidrón Cave in Spain, researchers found evidence that has been interpreted as possible use of medicinal plants, including bitter plants such as yarrow and chamomile. These plants are not exactly a delicious snack. Nobody is sitting by the fire saying, "Ah yes, bitter wheat again, my favorite." So why eat them? One theory is that Neanderthals may have used certain plants for their effects on the body. We have to be careful here. We cannot prove exactly what a Neanderthal was thinking. Maybe they ate the plants for reasons we do not understand. Maybe it was medicine. Maybe it was tradition. Maybe someone lost a bet. But the evidence is suggestive. It shows that ancient humans and their relatives interacted with plants in complex ways. They were not just chewing random leaves and hoping the forest had a pharmacy section. The evidence ladder goes higher. If we move forward in time, we find more signs of practical healing. Broken bones that healed, amputations that may have been survived in some ancient cases, skulls with holes made by human hands. Yes, trepanation. Trepanation is the practice of making a hole in the skull. And before you ask, no, this is not a recommendation. Please do not try ancient skull surgery at home. Your kitchen spoon is not a medical instrument, no matter how confident you feel. Trepanation appears in many parts of the world and goes back thousands of years. Some of the oldest examples are from the Neolithic period, which began around 10,000 years ago in some regions, when humans started farming and settling more permanently. The wild part is that some skulls show signs of healing around the hole. That means the person survived after the procedure, at least for some time. Why did they do it? We do not know exactly. It may have been used after head injuries, to relieve pressure, treat pain, deal with seizures, or for ritual reasons. In the ancient world, the line between medicine and ritual was often not sharp. If someone had seizures, strange behavior, or severe headaches, People might see it as both a body problem and a spirit problem. To us, that sounds strange. But honestly, modern people still say things like good vibes, bad energy, and Mercury is in retrograde when their printer stops working. We are not as far from ancient thinking as we like to pretend. Trepanation tells us something important. Ancient humans were not just passively waiting for nature. They were intervening. They were cutting, scraping, drilling, binding, cleaning, experimenting. Sometimes they were wrong, sometimes they were dangerously wrong, but sometimes they were right enough for someone to live. Then came plants. Plants were probably one of the largest parts of ancient healthcare. Humans used plants for food, poison, fibers, dyes, tools, and medicine. Some plants reduce pain, some help digestion, some fight infection, some cause sleep, some are toxic in the wrong amount. The problem is dosage. A plant can be medicine in one amount and a murder weapon in another. Ancient humans had to learn this the hard way. Imagine the first person who discovered a useful plant. Maybe they ate it by accident, maybe they watched someone else, maybe they saw an animal use it, maybe they noticed that chewing bark helped pain. Now imagine how many people had to make terrible mistakes before the group learned which plants were helpful and which plants were. Absolutely do not eat this unless you want your funeral to be educational. This is why elders mattered. Older people carried memory. In a world without writing, an elder was a library with knees. They knew where plants grew, which roots helped stomach pain, which leaves made swelling worse, which smoke kept insects away, which season brought certain sickness, which waterhole was dangerous. This kind of knowledge was not perfect science, but it was survival. Fire was another medical tool, even before people thought of it as medicine. Fire cooked food, and cooking makes many foods easier and safer to eat. It kills many harmful organisms, though ancient people did not know that in germ language. Fire gave warmth, which helped people survive cold. It kept predators away. It dried wet clothing and skins. It hardened tools. It created smoke that could repel insects. Fire also allowed boiling. Once people had containers that could handle heat. Boiling water helps make it safer. Again, ancient people may not have known why, but they could notice results. Cleanliness also mattered, even before modern hygiene. Ancient humans probably understood that some things were dirty in a practical sense. Rotting flesh, bad-smelling wounds, polluted water, feces near living spaces. In settled farming communities later on, waste became an even bigger problem because more people lived close together. When humans began farming and living in villages, life improved in some ways and got worse in others. More food could be produced. Communities grew, but disease spread more easily. People lived close to animals. Waste built up. Diets sometimes became less varied. Tooth decay became more common in some populations because of starchy foods, so medicine had to change. Hunter-gatherers needed care for injuries, bites, parasites, and childbirth. Farmers needed care for crowd diseases, infections, bad teeth, nutrition problems, and epidemics. Civilization did not magically make humans healthier. It also gave germs better networking opportunities. As societies grew, healing became more organized. At first, the healer may have been a parent, elder, shaman, midwife, hunter, or plant expert. A shaman is a ritual specialist, someone believed to communicate with spirits or unseen forces. In many cultures, the same person might treat the body and the spirit together. That does not mean they were foolish. It means their world did not separate mind, body, society, and belief the way modern hospitals do. If a person was sick, maybe the cause was a wound. Maybe it was bad food. Maybe it was grief. Maybe it was fear. Maybe it was a curse. Maybe it was all of those in the group's understanding. Healing was often a performance. Words, touch, smoke, songs, plants, rest, food, symbols, and here is the uncomfortable truth. Some of that performance may have helped, not because magic cured infections, but because humans are social animals. Fear affects pain. Trust affects stress. Being cared for helps survival. A calm patient may rest better. A group ritual may make the sick person feel supported. Food, warmth, attention, and belief can keep someone going. Modern medicine also understands that the mind and body are connected. We just use different language and more expensive machines. Now let's talk about one of the most underrated ancient medical workers, the midwife. For most of history, childbirth was one of the most dangerous moments in human life. Humans have large-brained babies and narrow birth canals compared to many animals. That makes childbirth difficult. Ancient women needed help. Other women, especially experienced mothers, likely played a major role. They learned positions, timing, signs of danger, herbs, massage, cutting the umbilical cord, caring for newborns, helping mothers recover. This knowledge rarely leaves dramatic evidence in bones or tools, but it may have been one of the most important forms of ancient healthcare. The survival of babies depended on it. The survival of mothers depended on it, and the survival of the group depended on both. This is where the story becomes less about objects and more about humans. Ancient healthcare was not one invention. It was a web, a person with plant knowledge, a hunter who knew how to splint a limb, a grandmother who knew which fever was deadly, a midwife who knew birth, a ritual healer who knew how to calm fear, a group that knew when to carry someone instead of abandoning them. All of that together was medicine before doctors. But there is another part of this story that people miss. Ancient healing was not only about survival, it was also about meaning. When someone gets sick, humans do not only ask, "What is happening?" They ask, "Why is this happening? Why me? Why now? What caused this? What does it mean?" Ancient people asked those questions too. If lightning struck a tree and someone became ill afterward, maybe the two events felt connected. If a child died after a taboo was broken, maybe people linked them. If a healer used a special chant and the patient survived, the chant became part of the cure. This is how ritual and medicine mixed. And before we laugh too hard, remember that modern people also create meaning around illness. We ask if stress caused it, we blame diet, we blame fate, we blame bad luck. We blame ourselves. We search symptoms online and somehow diagnose ourselves with 17 rare diseases in 8 minutes. Humans hate uncertainty. Ancient medicine gave people action. Even if the action was not always medically effective, it reduced helplessness. Doing something matters. Cleaning the wound, feeding the sick, singing over the child, burning herbs, calling the healer, making a charm, giving bitter tea. Some of these things helped physically, some helped emotionally, some did nothing, some probably made things worse, but they all came from the same human need, to fight back against pain. Over time, as cities appeared, medicine became more formal. In ancient Egypt, medical writings described wounds, treatments, and remedies. The Edwin Smith Papyrus, copied around 1600 BC but possibly based on older knowledge, is famous because it describes injuries in a practical way. It talks about examining patients, making judgments, and treating wounds. Egyptians used linen bandages. They used honey on wounds. Honey can help prevent the growth of some microbes because of its chemistry, though ancient Egyptians did not explain it that way. To them, it worked because experience said it worked. In Mesopotamia, healers used both practical remedies and ritual. Some treatments involved plants, oils, bandages, and beer. Others involved prayers and spirits. In ancient India, China, Greece, and other parts of the world, healing systems became more organized. People wrote medical texts, they classified diseases, they trained specialists, they created theories about the body. Were all those theories correct? No, some were very wrong, but they were attempts to make sickness understandable, and that is the beginning of medicine as a system. Still, even when professional healers appeared, most healthcare was probably done at home. That is true even today. Before you see a doctor, someone gives you soup, someone tells you to rest. Someone checks your forehead. Someone says drink water. Someone suggests ginger, honey, tea, steam, or whatever remedy their family treats like sacred law. Doctors are important. Modern medicine is one of humanity's greatest achievements. Antibiotics, vaccines, surgery, anesthesia, sanitation, emergency care, these things save millions of lives. But the first layer of healthcare is still care. Notice the word healthcare, not medicine care, not hospital care, care. Ancient humans survived without doctors because they had bodies that could heal, environments they learned from, plants they experimented with, fire they controlled, tools they made, and groups that protected them. Not always, not perfectly, not gently. Many died. We should not romanticize the past. Ancient life was not a wellness retreat with organic berries and sunrise meditation. It was brutal. It was painful. It was unfair. A simple infection could kill you. A bad birth could kill you. A broken bone could end your life. But ancient humans were not helpless. They were not stupid. They were observant, social, inventive, stubborn creatures trying to stay alive with no instruction manual. And slowly, they built one. Not on paper at first, in memory, in scars, in stories, in hands, in the way one person held another person still while a wound was cleaned, in the way a mother showed her daughter which plant to use, in the way a hunter limped for years because others helped him keep going, in the way a group gathered around someone who was weak and said, in action if not in words, "You still belong to us." So when did humans start medicine? The honest answer is we do not know exactly, but the evidence suggests that medicine did not begin in one place, on one day, with one genius ancient doctor announcing, "I have invented healthcare. Please bring me a cave wall for my diploma." It began gradually. It began with wound care, childbirth help, plant knowledge, bone setting, fire, food, rest, ritual, and social care. It began when humans noticed that some actions changed the outcome. This wound healed. That one did not. This plant helped. That one poisoned. This person survived because we stayed. That person died because we did not know enough. And every generation inherited the painful notes of the previous one. That is the real story. Ancient humans survived without doctors because before there were doctors, there were caregivers. Before there were hospitals, there were firesides. Before prescriptions, there were plants, hands, songs, guesses, mistakes, and memory. Before medicine became a profession, it was a behavior. One human helping another human not die today. And maybe that is why this story still matters. Because you, sitting in a modern world with clinics and pharmacies and search engines and tiny pills with names nobody can pronounce, are still connected to that cave. When you get sick, you still want the same things: warmth, water, rest, someone who knows what to do, someone who does not panic, someone who stays. Your body is ancient, your fear is ancient, your need for care is ancient, and every time someone brings soup, changes a bandage, holds a hand, drives someone to the hospital, or says, "I'm here, you're not alone," they are doing something older than civilization, older than writing, older than doctors. They are continuing the first medicine humans ever had. Care, which is beautiful, really, and also a little funny, because after 40,000 years of human progress, after all our science, machines, hospitals, and miracle drugs, one of the most powerful healing tools is still someone looking at you while you are miserable and saying, "Drink water and lie down." Ancient wisdom survives, mostly because mothers refuse to let it die.